Imagine a world where common infections become untreatable, and even minor injuries could lead to life-threatening situations. This isn't a dystopian sci-fi plot. It's a growing reality. And the Centers for Disease Control and Prevention, CDC, just sounded the alarm. A staggering surge in dangerous, highly antibiotic-resistant bacteria has been reported across the United States, raising urgent concerns about the future of public health. But here's where it gets even more alarming. These bacteria are resistant to some of the strongest antibiotics we have, leaving doctors with fewer options to treat infections effectively. According to a CDC study published this Tuesday in the Annals of Internal Medicine, http://journals.org/DOI/107326, Annals 252404, infections caused by NDM-CRE bacteria, a particularly menacing strain, skyrocketed by over 460% in the U.S. between 2019 and 2023. That's not a typo, 460%. To put this in perspective, this means that in just 4 years, the number of cases has multiplied nearly sixfold. And this is the part most people miss. NDM-CRE bacteria are not just resistant to 1 or 2 antibiotics. They can evade nearly all available treatments, earning them the nickname nightmare bacteria. The CDC's report, https://www.cdc.gov/mediareleases.html:, highlights the rapid spread of these superbugs in healthcare settings, where they pose the greatest risk to vulnerable patients, such as those with weakened immune systems or undergoing surgeries. But here's the controversial part. While hospitals are on the front lines of this battle, the overuse of antibiotics in agriculture and the general public's misuse of these drugs are often overlooked contributors to this crisis. Are we doing enough to address these root causes? Or are we simply reacting to the symptoms? This isn't just a problem for doctors and scientists. It's a call to action for all of us. Antibiotic resistance is a silent pandemic, growing stronger with every unnecessary prescription and every unfinished course of medication. What if the next time you need an antibiotic, it simply doesn't work? The CDC's warning is clear. We must act now to preserve the effectiveness of these life-saving drugs. But the question remains, are we willing to make the changes needed to prevent a future where infections are untreatable? Let's discuss. What do you think is the most critical step we can take to combat this growing threat?